In terms of organization Catalysis, so those of you that aren't familiar with us, it's our ultimate goal to transform the healthcare industry. We do this through careful research that includes listening to our healthcare leaders, sharing best practice, and you're going to hear some of that sharing today from both the vendor Qventus and Peggy from Fairview Health System. And applying this to innovative knowledge, so learning, sharing, connecting in order to accelerate change. Next slide. So we do have organizations that we collaborate with. Many are very well known, as you see here on the list. Next slide. And of course, our network sponsors, of which Qventus is a big sponsor of ours. And our sponsors are chosen carefully. We don't take anyone who's willing to be our sponsor. We take organizations that are highly innovative, those that don't lead with technology, lead with process, and are in this for the right reasons. Next slide. And with this, I'll turn this over to Tiffany.
Great, thank you, Brian. Welcome everyone to today's webinar. And as you can see, today we'll be talking about applications of automation and machine learning for optimizing patient flow. So my name is Tiffany Chen. I am a senior product marketing manager from Qventus. I spent the past few years working with a number of hospital organizations to improve their operations with technology. And I've also led several software deployments in the past. My background before hospital software was in strategy consulting with various healthcare organizations, as well as clinical data analysis at MIT. And today, we're lucky we have Peggy Destin from Fairview Health Services in Minnesota. And she's the nurse manager for emergency services at Fairview Ridges Hospital. And she'll be talking to how her facility has been using automation and machine learning to optimize patient flow. Peggy, would you like to introduce yourself?
Yes, thanks, Tiffany. As Tiffany said, I'm the manager for actually the busiest ED within our system, fourth busiest in the Twin City area. I've been at Ridges for over 20 years now, and I'm going to tell you that I've spent most of my 30 plus, I'm not going to add it all up, years as a nurse in an emergency setting. I've spent some time working with neurosurgery trauma center and have had the opportunity to work with smaller healthcare systems and larger healthcare systems within my career.
Great, thank you, Peggy. And so in terms of objectives, today we'll be focusing on two key objectives today. The first is using automation and machine learning to help caregivers focus on value-added activities. We will also be discussing how to engage frontline teams with the technology to drive results. So we'll first talk about what automation and machine learning are. And then we'll walk through a case study of how Fairview is using these technologies to optimize patient flow. And we'll end with an overview of change management strategies that sets the foundations for transformation. Before we start, I'll just quickly introduce Qventus. We are the first system of action that engages teams in optimizing patient flow in real time. And this can be within departments and facilities or across hospitals within a health system. And we help improve flow by combining intelligent automation with our transformation services. We work with over 80 hospitals and health systems across the country and have helped them streamline patient flow. You can see here that we've helped impact key metrics such as length of stay in the ED and inpatient settings. And we've worked with hospitals on key initiatives such as resource coordination and discharge planning. As you can see, we work with leading health systems such as Fairview, which you'll hear from today, Mercy, New York Presbyterian, and Emory. So first of all, what is automation? Automation is the technology that lets us perform a procedure or a process with minimum human assistance. Let's take driving as an example. If you think about driving back in 1995, you had to manually plan out your route, listen to the radio for traffic updates, and adjust accordingly. You'd need to quickly hit the brakes if the car ahead of you makes a sudden stop, and make sure to check for blind spots when switching lanes. Now, today, we have technology to automate many of these processes so that it's less heavy lifting to get safely to our destination. Google Maps, it automates the route planning process and adjusts in real time when it detects traffic. We have built-in automated safety features to help you prepare for the unexpected. Things like automatic emergency braking, blind spot monitoring, or lane keeping assist. And these technologies are running in the background and nudging you to take action when an issue needs your attention. You still have control as the driver if you want to diverge from the route that Google Maps has for you, or you can also speed up or slow down even with adaptive cruise control on. Another term we commonly hear these days is machine learning. So what is it, and how is it different from artificial intelligence? First off, AI, it is the technology that enables computers to mimic human-like behavior and intelligence, especially when it comes to processing large amounts of data that humans don't have the individual capabilities for. Machine learning is a subset of AI that refers to the way computers learn from new experiences and updates its understanding of patterns in the data. An example of this in our everyday life is how Netflix learns which shows to suggest to you. When you watch shows on Netflix, the software is assessing what patterns of shows you like behind the scenes. It is recommending new shows and movies to you based on things that you've watched or rated highly. Every time you try something new, the program is updating your preferences and adjusting which shows to recommend. So, how does automation and machine learning apply to hospitals? We've heard of people being wary of AI taking over clinical decision-making. And while that is something that could happen in the future, that is not the focus of the webinar today. Our focus today is on how automation and machine learning can achieve tangible impact on patient flow. There are many manual activities that fall on your frontline teams that are associated with the logistics of patient care. So for example, going to the computer to pull up dashboards to check if the patient has a bed assignment yet. Or it's the back and forth calling to make sure the right patients are prioritized for services like transport. Your best experienced charge nurse or other staff, they might already have an intuition about where to focus the team's attention, but you can't expect that charge nurse to always be on shift, and you can't scale him or her across all of your units. Today, we use intelligent automation to help teams with patient flow. The software can ingest and analyze large amounts of data that individual humans cannot. And with the intelligence running in the background, it can help teams anticipate bottlenecks, build situational awareness, and detect when patients are stuck in process steps. And just like when your car nudges you to take action when it detects you're drifting out of lane, the intelligence nudges your team to mobilize and collaborate in real time when issues are detected, such as escalating patients to the nurse supervisor or to ancillaries. It can help dynamically prioritize key activities or patients as events unfold and help optimize resources across units or facilities. So like the way driving technology today is helping you get to your destination safer and faster, intelligent automation is maximizing your team's time by making it easier to move patients swiftly across the hospital. This way, you can scale that intuition that experienced charge nurse has across your units, and frontline staff can then focus on the clinical aspects of patient care. Let's take a look at Fairview Health Systems as an example. Fairview operates 12 hospitals and medical centers and 9 emergency departments in Minnesota. And to deliver a more consumer-centric experience and quality care to a growing number of patients, it recognized that it needed to evolve from managing its hospitals as separate entities to a more integrated delivery system. Fairview is working with Qventus to develop its System Operations Center, which uses intelligent automation to balance patients and coordinate resources across the entire health system. Now, Qventus is also helping Fairview address patient flow within an individual hospital. Bridges was one of the first hospitals that got started with Qventus, and we have Peggy here with us today to share some of her experiences. So like many EDs, Bridges was having challenges with identifying the resources it needed in real time to help patients move through the ED. Teams would pull in additional staff or clear beds when there was already a surge in demand, and they would need to coordinate back and forth via pages or phone calls to work together. Peggy, can you provide a brief background of Bridges and the ED environment?
Sure. So we are a 45-bed ED that sees about 67,000 patients a year, 20% of those being pediatric. And we have a 150-bed hospital. So we outgrew our hospital probably quite a few years ago when it came to our volume. Due to our lack of inpatient beds, throughput has been a real challenge for us. And we continue to grow. We know that we need to look at our throughput, and we need to make some changes in order to decrease our length of stay so that we can make what we call virtual hours or virtual bed hours for us to meet the needs of our growing community.
Got it. So from your perspective, what were the biggest patient flow challenges you were having?
So for us, our biggest challenges really is our boarding patients, being able to streamline our admission process. And like I said, our lobby was getting backed up. We were finding we were having longer waits. And of course, that leads to increased left without being seen, which is not a number you want to see going up.
Got it. So Bridges and Qventus work together to use machine learning to predict if the ED would be overcrowded in the next 1 to 2 hours. This is like Google Maps warning you of traffic up ahead and prompting you to think about changing your route. The machine learning analyzes data in the background, like how Netflix analyzes your viewing activity, and it takes into account factors such as staffing, throughput metrics, time of day, day of week, etc., and is continuously learning about the key patterns specific to ridges that are linked to ED overcrowding. And when overcrowding is anticipated, Qventus nudges a broad range of stakeholders to take action through this virtual huddle on their mobile devices. Peggy, before Qventus, how were surge plans triggered? Was there a surge plan in place?
We did have a surge plan in place. It involved the ED charge nurse manually filling out paperwork, trying to capture data for me so that I could attempt to make it better and improve our throughput and find out where our bottlenecks were. But it was really reactive versus proactive. They would be in the midst of the surge, and it would require them not only to fill out this paperwork for me, but then multiple phone calls to our nursing supervisor, phone calls to the inpatient charge nurses to try and get patients upstairs. It kind of took my charge nurse out during the time when they really needed to be managing the chaos of the surge, which really was not the best use of my charge nurse.
Okay, and how did Qventus automate some of that manual work we just described with identifying and preparing for the surge in demand?
So our charge nurses actually love this surge alert that they get. They get like a 2-hour warning that a surge is about to occur. So it allows them to be proactive. It allows them to make staffing decisions. We currently have a process where when that surge alert goes out, we put it on our Epic header. So everybody in the department knows that we have a surge coming. And what that does is it helps the frontline staff be able to prioritize their work a little bit better too. And it's like, now they feel like they can react to the fact that these patients are coming in. It's kind of like having a car crash and then deciding that you need to figure out how you're going to deal with the crash that's happening, whereas here they can be proactive about the fact that they can prevent the crash from occurring within the department because they've been able to prioritize their work. They've been able to communicate with the key players that can help with the throughput from the inpatient side. So communication is going through the Qventus app, and everybody's on the same page. Everybody's getting the information at the same time. And it has eliminated all of the paperwork, which they love, and it has eliminated the multiple phone calls that they were involved in. And it's kind of like an early warning system that we have in our car. Wow, expect this, and now we can have it before it happens.
Got it. Thanks, Peggy. Regis and Qventus also set up a mission control view of the ED to help the department create more real-time situational awareness. And this allows the ED teams to see which process steps patients are being stuck in. And Peggy, before Qventus, how did your team go about identifying which patients needed help moving through the ED?
They probably didn't, to tell you the truth. So, as I said, a busy ED that sees a lot of patients a day, for one charge nurse to manage 45 beds and kind of have a unique footprint, which is a potted area, they literally were running from place to place to try and figure out where the delays and stuff were going on and why those were going on. And unfortunately, I think what happens is you get the charge nurse who gets tied up in the actual organization of the chaos that's going on, and you lose track of how long patients are there. It's like if you don't have a timer in your pocket, you don't really realize how much time has gone by. And now they have this automatic timer in their pocket that tells them, wow, we have a delay in the admission or we have a delay in our discharge.
Got it. And you sort of touched upon this, but how has this mission control view helped save time for your charge nurse or team?
So for our charge nurse group, they're able to see this view that you have here, and they know how many patients do we have in the waiting room, and as they love the fact that the color changes based on time. How many pending admissions do we have, and as those colors go from a lighter pink to a darker pink, they know that that's a delay for that patient. And for our triage nurses, they like the fact that, I mean, from a nursing perspective, this looks like a CT or an ultrasound to me. So we can relate to the circles, but the bigger the circle is getting, you know, the more orders there are, the more acute the patient is. And again, they can take a look and say, who's tied up with the most acute patients and where should we place the next patient? Or who has the most admissions in their assignment and who may be tied up with those admits, so maybe we place the patient somewhere else.
Thanks, Peggy. And Regis and Qventus also engaged teams to focus on patients waiting to be discharged or admitted. In Qventus, it analyzes the EMR data for disposition patients and nudges teams to act when it detects patients waiting for an unusually long time. And Peggy, so why did Regis decide to tackle exit delays?
So for us, that's 80% of our patients are discharged, 78 to 80% of our patients. And so it felt like that was going to be the biggest bang for our buck. We would get our virtual beds by decreasing the length of stay of those discharged patients. And it was also something that internally we could impact. We had the control over being able to get those patients discharged in a timely manner. And we've seen great results with it.
And how was your team or your staff tracking exit delays before there was Qventus?
There was no tracking. There was no timer set anywhere. There was nothing to nudge us to say. There was no warning system for us to say this patient has been in the queue for discharge for could have been 30 minutes, and nursing is tied up with and prioritizing differently with the work that they had, where now this has become something that's forefront for them, because they know if they don't get their patient discharged in the time frame that we set for the nudge, the charge nurse is going to be asking them, what's the delay? What can I do to help get this patient out? And what's really great is that we have those canned responses within there, so we can track what is our delay, what do we need to work on. And so that has been very helpful for me and very helpful for us to make some changes. For instance, we found that our process for doing the complete registration was really tying us up. And many times we were waiting to discharge a patient just because we were waiting for the registration to be completed. So now we've changed our process and how we do that. And it's rare now. I find it interesting that is probably one of our lowest reasons as to why a patient hasn't been discharged.
Got it. Thanks, Peggy. And Peggy, you touched upon this earlier with regarding to using data to drive change. And so Qventus, it draws data around areas such as most active users responding to nudges and omitting units for which patients are waiting to be transferred to. And Peggy, how did you use this data to engage your teams or other departments to drive change to improve patient flow?
I was able to actually have real-time data that I could share with my inpatient partners. I think it was pretty eye-opening for them to realize what was the delay for the admission process. And what's great is I go to one place and I get what I need. I mean, I come in the morning and I log onto my computer, and the first thing I pull up is Qventus, to tell you the truth. And so being able to share the actual data with them and to be able to work with them together and say, what can we do with this process to make it more streamlined, is been wonderful. And I can find just about everything and anything within that Qventus data. And I've even used the data to take a look at like our triage process. If we've done some orientation and oriented new staff out to the triage area, I can take a look at how long does it take by nurse, the nursing staff, to do a triage. I can decide, wow, maybe somebody needs a little bit more help or education out there. I actually just went through a process that is changing our triage navigator based on information that I got out of Qventus about how long does it take to do a triage. That epic change is now will go system-wide the 20th of this month. So I'm pretty excited about that.
Thanks, Peggy. And we've talked about the software component that helps optimize patient flow, but oftentimes one of the hardest part of the deployment is the cultural shift that needs to happen. At Qventus, our approach to change management consists of 4 pillars. For training and education, the focus should be on the why and how to achieve success, including why the software is relevant for the team member's particular role. At Qventus, we have a training platform that offers short videos of different types of users describing how they're using the product and how it has impacted their day-to-day work. The communication piece of the deployment is also crucial. It needs to happen before go live. It should include why people are being asked to change what they're doing, what actions you expect them to take, and what success looks like. As part of change management, it's also important to work closely with the front lines to develop and iterate on the solution. It includes getting input before the go live to how the solution can be best configured to fit needs, and also getting feedback afterwards of any adjustments needed. Finally, people need to feel supported and empowered. With a solution like Qventus, frontline teams have the information on their mobile phones to make decisions of which patients need to be prioritized, which studies need to be expedited, etc. And sometimes these are decisions that would otherwise have to go up the chain of command. And Peggy, what were some of the methods you used for change management associated with Qventus, and what worked well for you?
So first I'm going to say I probably have the best team in the world. They are very engaged. They're very patient-centered. But we announced early, as soon as we found out that we were going to be a pilot area for Qventus, I mean, we do daily huddles here 3 times a day, actually, with our frontline staff. And I said, we have this great opportunity. I really don't know anything about it yet, but this is coming down the pike. And I say announce early and announce often. So we talked a lot about it within our huddle groups, in our charge nurse meetings and stuff, prior to Qventus even coming in. And then keep talking about it. And then once I got to know a little bit more about it, I was able to communicate why we wanted to do this. Most of my staff will say there was frustration with the amount of patients we had waiting in the lobby. There was frustration with how long it took us to get our patients admitted within our facility. And for them to hear that this tool was something that was going to help them with the frustrations that they had is what they needed to hear. So lots of communication verbally, via newsletters, postings that went up, and then asking for their advice. For instance, we worked with the charge nurse group when we talked about what numbers did we want to use for surge capacity. And again, because of our footprint, we have different pods that open up at different times of the day and day of the week. And so Qventus was great with working with us as we changed parameters. And every time we changed a parameter, we talked about it for a couple of days. What are you guys thinking? Do you feel like you're getting it early enough? Do you feel like you're in the surge before it happens? Or do you feel like it's coming too late? And so taking that feedback and making them part of the solution really kept them engaged in the process. We did the same thing with our delayed discharge nudges. In December, we had a huge influx of patients. It was like major chaos in our ED. And they said, Peggy, we're getting too many nudges right now on our delayed discharges, and we can't do anything different than what we are. So worked with Qventus and said, let's change this parameter for right now, and we'll change it back. So listening to what they had to say for their input and making some of the decisions based on what they felt their needs were. And then we were able to, in January, put our discharge nudge, I think it was January, back to our original goal. And that's what's so great about working with this Qventus team is that you send an email or you make it and you get response very quickly, considering the fact we're 2 hours difference from each other. And parameters are changed, things are done quickly, and the staff feel like they were heard because they gave that input. And then I think just being out there, supporting the team. For me, having Qventus up on my computer, my mission control, has allowed me to see what's going on in my department every hour that I'm here, or every hour that I'm not in a meeting. But to be able to go out there and say, oh, I just saw in mission control, we just got an influx into the triage area. What do you need me to do? And so for them, it feels like this tool has helped, and it has helped me have better awareness of what's going on in my department. And like I said, they're a great group of people that really want to meet the community needs, and they see this as helping them do that. And then letting them know, posting something. We have a board, it's called our huddle board. I mean, they know every day if we're winning or losing when it comes to throughput.
All right, thanks, Peggy. And with the combination of software and change management, Regis has been able to decrease length of stay for discharged patients and decrease dispo to admit times. Preliminary results are 14 minutes decrease in length of stay and 13-minute decrease in dispo to admit times. In terms of benefits, Qventus has automated many of the manual work that Peggy described. And there's also a sense of stronger sense of teamwork and increased awareness of why patients are being delayed. And I think Peggy, you can probably speak to this better than I can. But Peggy, so how has Qventus changed the culture at Ridges and the way teams and departments work together?
Well, it's allowed for some transparency to occur, and it's allowed for real facts and data to be shared across. We did an interdepartmental team to work on our length of stay for our admission, and to be able to say, this is, because of our canned responses, this is the delays we're seeing with the admission process. We actually implemented some new processes around our admissions based on feedback from the inpatient teams and the ED teams. And prior to that, you don't know what you need to fix because you don't have the facts behind it. You don't have the data to help support the fact. You can anecdotally think you're going to work on something and it might help, but you don't really know. And so you put something in place, and it's such a manual process to try and pull data to figure out if it's helped or not. By the time you've got the data, you don't know if it was really the thing that you put in place or if it's something else that occurred in the last 2 months. And so I feel like the relationships between the departments have improved. People are working together more. There's, like I said, that transparency between departments. Even lab and imaging, who now have the information, like when a surge capacity is coming, they can take a look and say, wow, we know that within a couple hours, the ED is going to be up to their eyeballs in patients. They can change some of their work processes and be prepared for it too. So it feels like the team is working together more. And I think that we have to remember this is all about patient care when you look at it. It just makes life easier to find the data that you need to do to make the changes that you want to make. People need to find out what works for their department, but we can't fix something that we don't know about and that we can't track.
Thanks, Peggy. Anything else you want to bring up before we close?
I would just say that, I'll be honest, when this first was coming down on the pike, it seemed a little different to me. I wasn't sure where we were going to be going with this. As we have worked with this team and as we've learned more about Qventus, I'm just so excited about this journey that we're on. I see nothing but positive and unlimited opportunities to work together as a bigger system. So it's really a fun and exciting time, and you will find that the staff in the ED feel like it's a really fun and exciting time. And again, I want to say kudos to this team because I always feel like there is just the great ability for collaboration with this team. And the only other thing I'm going to say is if anybody has questions or wants to reach out to me to ask me anything specific, the team has my contact information.
Thanks, Peggy. And that actually brings us to Q&A. Brian?
Hi, Peggy. Peggy, I do, again, want to thank you. And I got some questions here for you to come up. But again, thank you and a great story. And thanks for all you do. Reminder the group, down at the bottom of your screen is a little control panel. If you click on the Q&A icon, you can type your questions and we will do our best to answer them in the time we have left. Peggy, we have one question so far. One is, When you listed the 14 minutes of reduction in length of stay and 13-minute reduction in disposition to admit times, do you know what the original times were? So the reductions are listed, but not the original times.
Oh, good question. It's been a while since I dug into the original times. For our admits, I think we were at like 210. And for our discharges, I honestly don't remember. I know that when we started this, we were looking at overall length of stay and saying that we were at 180 minutes for overall length of stay with discharged and admitted patients. And our goal was to get down to about 165 to 170, knowing that once we hit that goal, we probably want a different goal.
Great. You know, it's funny as we work and you're part of our network, so I can hear the lean terminology and things, but it's amazing how many organizations focus on the production of data information. And I give the organization credit because they're really focused on the consumption and the action part of it and focusing on how it removes waste from, you know, critical skills like nursing and things. So a couple more questions here, and I think this could go to either Tiffany or Peggy. What are you using to predict a surge in ED volumes? What types of things are used?
Yeah, so this is Tiffany, and I can address that. So, and I assume, and please correct me if I'm wrong, that you're asking about what sort of data we look at to make those predictions.
Yes, I believe that's what he's asking.
Okay. Yeah, so we look at a large variety of data. As I mentioned earlier, there are things like throughput statistics and things like who's on staff, things like patient acuities, and you know, in terms of time, things like time of day, et cetera. So that's information I'd be happy to talk offline about if you want to dive into further as well.
Okay. There's a question here about, with the surge alerts, about what % were accurate? So kind of what's the range of accuracy when you really saw a surge occur?
So I'll speak to that just a little bit, and then I'll let Tiffany add to that. When we first started, like I said, we worked with our entire team here. It took a little bit to find what we would call our sweet numbers to figure out where exactly those numbers are for our department. And I would say you have to be patient, get the feedback from the staff. So at first it was a little hard. We figured out we actually had to have two different parameters, like a mid-morning parameter and a parameter that was more of an evening parameter for us. So we made some changes, and boy, I can't even tell you how many months now it's been that, many months, that it's really accurate. It is surprising how accurate it is. And it is so accurate that my charge nurses are making staffing decisions about calling people in or sending people home based on those surge alerts that come through. They love the surge alert. But as a side note, I'm going to tell you that it was really kind of funny. We get a phone call from Qventus one day and said, "We don't know what happened on Sunday. It seemed like our surge alert wasn't accurate." And so there's somebody in the background always watching it. And I had to laugh and say, we forgot to tell you about the home Vikings games. And we know anecdotally that if there's a home Viking game here, everybody looks and says, if it's a noon game, man, we're going to have a really good day, but watch out in the evening. And it was funny to see that actually probably needs to go into our surge alert information.
And you did describe earlier how you did PDSA this, so there's been quite a bit of PSA thinking going in and adjusting as you learn. So I think that, kudos to that, but it isn't just a fire and forget type system. A question is, has there been any thought about using this in urgent care or ambulatory settings in your organization?
Yeah, so right now we're focused on patient flow within health systems. Those are certainly areas we'd love to explore, and we can chat offline about kind of some of the challenges that you may be having in those care settings and how we may be able to help.
Okay, thanks. Question, when an inpatient bed needs to be cleaned, does someone manually have to alert EVS to escalate the cleaning, or does Qventus or the system send an alert to that team?
So I can speak to that. Not anymore. It used to be that they would have to make a phone call. AVS now gets looped in, but they also get looped in on our surges. So they've changed their process. If a surge alert has come through and there are some there's usually multiple beds that need to be cleaned at a time, they actually changed their process. So instead of one person going in to clean a bed, they're putting two people in to clean that room quicker, so that when we need the bed, we can start pushing patients up faster. So they have found that between two EVS people cleaning a room versus one, we gain probably about 23 minutes. So we can put them into that bed 23 minutes faster.
Wow. Thank you. So next question, can you speak to the specific physician change management strategy? So how have you convinced the physician or the ER docs to accept this?
So I feel like I'm bragging about people, but we have a very engaged group of physicians too. They were involved in helping making some of the decisions around our nudges and our timing. They personally right now are not carrying anything that's nudging them. But what they love is the fact that we've become more efficient. And with that efficiency, they become more efficient. We are currently talking about a process potentially that is going to involve nudging for them when all of their labs and stuff are back, so that they have that awareness. I think that's down the road. We're working on doing something more with our lab and imaging right now. Like I said, I see lots of avenues that this can go, and sometimes I have to rein myself back and say we can't do all of it at once. But they also are getting the data from our medical director here too, and like I said, they have been able to be more efficient with their cares because nursing is more efficient.
Great. We talk about it in our network. The sequence of this is mindset, skill set, tool set, and how you have to work in that sequence. And one of the reasons we like Qventus as a sponsor is they have that thinking. They understand why they're here, and they spend a lot of time up front really getting people to understand the why before they try to push the technology. So another question here, and I think either one, probably Tiffany's better to answer this. There's assumption that there's some real-time data from Epic or from an EMR coming across. What are the processes, or what kind of data comes across live?
Yeah, so we typically integrate with via HL7 feeds, and I can certainly connect you with the integration team for further detail, but depending on the area of focus, whether it be ED or inpatient, we work with the IT teams to make sure that those feeds are being fed into the Qventus software and ingested appropriately. So we do have an in-house integration team that works with hospital IT throughout that process.
Good, thank you. I've got a few more questions here before we wrap up. Question is, I think you answered this already, but maybe it goes into other types of external data. It says, can you put the football game schedule or other external factors into the machine learning model? I think you answered or maybe that's in the works.
Yeah, I would love to connect you to our data science team who can probably speak in more specifics and more detail than I can about this.
Okay, yeah, we have another complex data science question we'll have to have you respond with. Okay, reminder, one last chance. We got the Q&A button on the bottom. I just have one to think about. So as you begin to think of your staff, how do you train new users that come in? Obviously, they don't learn this when they're in school or something. How do you, how do you train new members and new team members about what this is and how to use it? That goes to Peggy.
So, yep. So for us, this has become part of our culture. This is part of our onboarding. New staff come in, and it's part of the orientation. We talk about why we're doing Qventus, what we're looking at, why the charge nurse may call you early because of a surge. You have to adopt it within your culture. And if you do that, it just becomes what people talk about. It's probably not teaching anything different than a process that you have at your facility that somebody else doesn't have. And then Qventus has been really good as I've onboarded some new charge nurses. They've offered to come out and do another training session with the new charge nurses that I'm onboarding. I think that's a great offer. I feel like the group, my charge nurse group that I have right now, will help them with that. I think that we plan on still having them come out just because as we're implementing this deeper into our hospital, there will be training needed for the rest of the hospital also.
Okay. I have one last question and then we'll wrap it up. So if the EVS has the capacity to respond right away, have you done any performance improvement work to get to the root cause of why the EVS needed the nudge? For example, why did you have to alert them? They just didn't realize there was already an empty room.
We looked at that, and it's not that they didn't know there was an empty room. It's that they're changing the process of sending one EVS person to each room to clean them. And so let's just say that there's, I don't know, 5 rooms that need to be cleaned. One person going to the, if we have 3 EVS people on and they're all doing a room by themselves, it takes longer to clean that room. And so if the surge alert comes out, then they know that they changed the process and they pair up and they go into a room and they do it quicker together. I know that EVS has looked at the data and, like I said, have shaved off those minutes, like 23 minutes, I think is what it was, to turn a room around quickly. Why they don't do that all the time, I don't have the answer to that.
Okay.
That's out of my wheelhouse.
All right. Well, Peggy, again, I want to thank you very much. I'm very impressed when I work with organizations that are far along the maturity scale. How nurses and clinicians and these people can really speak with data and that discipline to use data for improvement and get into those rapid PDSA cycles. So congratulations and good luck with your future endeavors here.